Can you remember a time when you helped someone achieve or learn something? Perhaps you taught a child how to ride a bike, or you taught a coworker a new task, or someone to learn a math concept. Well, I saw a patient the other day, we'll call her Beth, and she needed help. She came from northern Kentucky to Ohio State University with her husband and her son because she had been dizzy for over a year. She herself was a medical specialist. She was a retired nurse, and she had obvious family support. She had seen a number of specialists in her area and a physical therapist and was unable to get any answers or achieve any relief of her dizziness. Well, I got to know Beth a little bit, and I took some measurements, and it turned out she had a fairly straightforward situation. She had a unilateral vestibular hypofunction about a year ago, and then had some neck issues and developed a secondary cervically mediated dizziness. All of this progressed into 3PD, which was really driving her symptoms right now through central sensitization. While I explained this to Beth and her family, Beth teared up. She had been a caregiver for her husband, who had some medical issues himself, was used to doing a lot around the house, and was unable to do that, was unable to drive, and she felt like she was finally getting some information. Her husband commented that he really appreciated the amount of information, but more than that, the way it was presented to him and my communication style. Seeing that light bulb turn on was very meaningful to me, probably similar to how you felt when you helped somebody learn something new. I've had the opportunity at Ohio State to teach in a number of situations in groups ranging from 5 to 100 plus. Individuals in those groups have included other physical therapists, occupational therapists, physical therapy students at the physical therapy school, both in their first year and an advanced course in their final year. I've taught PM&R residents and groups of larger professionals at the Concussion Symposium. In each of those situations, I work to first understand my audience and what it is that they really seek. And then I work to prepare my material and organize it in a way that will facilitate their learning process. And finally, I seek feedback from them. I've had a lot of good feedback over the years, similar to what I got from this family, as well as from my larger audiences. And I've had some good constructive feedback as well that has really helped me improve my presentation. During that time, I've learned, most importantly, that when I teach, it's not about me. It's about the message I bring and the information that I have to offer. I'm very passionate about helping and serving others, and I'm excited whenever I can be a part of that process. Hopefully that begins to explain why I'm interested in this opportunity. Learning about vestibular problems and other disorders which cause dizziness is very interesting to me. But what really energizes me is teaching others about vestibular disorders. In my 21 years of treating patients with dizziness, I've seen a marked increase in the awareness of possible causes and treatment options of dizziness. Physical therapy is being prescribed much more frequently, and there's a growing interest among physical therapists to learn more about vestibular rehab. Dizziness can be very complex, and I love to help others understand it better and feel confident about treating this patient population. I feel there are many important contributions physical therapists can make when caring for patients who are dizzy. First, to really connect with the patient and understand their problem. Oftentimes, they have some level of anxiety or depression. They may have felt neglected because they've not been understood by their health professionals and other people around them. Secondly, to assess them well and communicate clearly to them about what seems to be causing their symptoms and what they can do to be a part of the process. Very importantly, we can collaborate with other health professionals. Oftentimes it involves a team to treat these patients, and we can pull in other therapists, occupational therapists, other health professionals. We can educate others about what are some possible treatment options and some assessment procedures for these patients. I've worked with Dr. Ost to treat many patients starting in 1998. He is truly a joy to work with, and I've learned a lot from him, and I'm excited about this opportunity to partner with him through MedNet. Would you consider me to be part of this opportunity? I really appreciate the consideration.